And now we have this like huge problem that people don't trust medicine anymore. They don't trust doctors. They don't trust the CDC or the agencies. They basically don't trust anything, and they don't want to get vaccines. They don't do anything. And we have the highest rates of exemptions, the highest rates of people not getting vaccines, and trust is gone. And that's a big problem. And medicine's solution to that thus far has been like double down, just force people to do it. And that is not going to work.
Your organization has achieved a significant dent in vaccine mandates.
We didn't do the science. We didn't do the clinical trials. We didn't do the post safety. But one thing we know it's rare.
Hello, and thank you for joining us for another episode of Shot Callers. My name is Carrie Bigford, and I am the Outreach Director with Texans for Vaccine Choice. And today we have a very special guest, Dr. Joel Warsh, who is an integrative pediatrician, author, and speaker from California. Dr. Warsh also is originally from Canada and has a master's degree in epidemiology and has written a phenomenal and very on-time book called Between a Shot and a Hard Place. And so without further ado, I would like to welcome Dr. Joel Warsh to the show.
Thank you for having me on. I'm excited to get into this.
So you're a licensed provider in California, a pediatrician. What is that like for you right now in that climate?
Obviously it's an interesting place to work for sure, especially in the space of health freedom and discussions. I mean, I would say thus far, knock on wood, everything has been okay for me. Even with the vaccine book coming out, I wasn't sure how it was going to be, but I've really tried to maintain a balanced approach. I've tried really hard not to tell people what to do. And I think hopefully that can, preserve me from getting into trouble or dealing with the powers that be, which are obviously pretty strict in California. Certainly the vaccine rules are very strict in California. And I genuinely believe we shouldn't tell people what to do. I feel like you should be able to make your own decisions. And that's what I've stuck with. And that's what I do in the office. And that's what I talk about in the book. And that's what I just generally talk about. So I think hopefully that's okay, because I think once you start getting into medical advice and telling people what to do or not to do, then that's where people have gotten into trouble. But yeah, I think it's a very interesting time, a very crazy place when it comes to anything to do with medical freedom. And so it's really been quite the wild ride. But thus far for me, so far, it's been okay.
Well, I'm glad to hear you're still faring well. I came from California originally, so I lived there for almost 30 years of my life. And I agree with you 100% on the choice stance. I mean, I literally work for Texans for Vaccine Choice, right? And it can be challenging to walk that line of informing people while keeping your own naturally there human bias off to the side, right? So
Correct.
Being in California, my understanding of the implications of SB 277 and SB 276 is that it makes it almost impossible for a medical provider to write a medical exemption, and that there's even an automated inquiry into your fitness as a doctor if you write more than 5 exemptions. Like how are you operating in this space of choice in a land of no choice? I mean, how can you write a medical exemption?
Right. So there are a few things there. So I guess going back for me, I'm not against vaccines or totally for vaccines. I think that people should be able to make whatever decision's best for them. And in my office, we have people that do all the vaccines. Some go on a slow schedule. Some don't do them. I don't force people to do anything. And we just talk about it, and they come up with whatever decision's best for them, which is the way that every other thing in medicine is. It's not like you force people to get a cancer medication or whatever. You talk about the risks and the benefits, and they decide if it's right for them. So that's the way that I practice. The rules are the rules, and there's not much you can do about them in California. They're quite strict. And you don't really have a lot of say for exemptions because everything goes through public health anyways.
Yeah, I know.
So the way that I get around it is there's no way to get around it. I mean, you have to qualify based on the strict standards that the CDC has, which are extremely hard to do. So you really can't do an exemption unless it meets those standards. And so it's really up to parents to decide what they want to do. And some people choose not to do vaccines and they homeschool. Some people move, or some people decide to do it and they just do a slow schedule and they work their way through. But we, as providers, unfortunately, just don't have a lot of choice or a lot of wiggle room in California. Because even if you're hardcore and you're like, all right, I'm going to do it, I'm going to give you vaccines, you're just going to get in trouble. They're just going to say no. So it's not like it works because you can't, they see them all. So there really is not that much that you can do about it. And that's up to the patients, which I think it's unfair, but I hope that we fight back, and there is some fighting back. I feel like the most likely path back is religious freedoms and religious exemptions. I feel like there's a decent chance that might come back in the long run, but at least as of right now, that's still not a thing in California.
Yeah, we get so many calls, and I still have loved ones there, and it's a terrible place to be where you have to choose between allowing your child, free access to a public education and everything that goes with it, or, violating your own religious or deeply held philosophical beliefs, or even your medical fears, because I know that the guardrails they've put around you in terms of what's an allowable medical exemption are not great and do not reflect the known scope of, acceptable medical exemption reasons in other places. Like, it must just be, I have such compassion for the practitioners who are still trying to practice there. Yeah.
And parents, I mean, I get it, because I understand why they did the rules the way that they did. I mean, they want to get people vaccinated, and that's obviously going to work if you kind of basically force it. But that is a major cost. Like, it's not right. There are many reasons why, if you have a reasonable discussion with a parent and they've had a reaction, or they have had issues in the family, or they have certain conditions where there certainly increases, it does certainly increase your risk to have a reaction from a vaccine. There's no question about it. Nobody would argue that. I personally feel like if you understand that, you understand the risk from the disease, you understand that there is a risk, because let's say you don't get the measles vaccine and it increases your risk to get measles because you don't have it, but you decide, well, I don't want the risk from the vaccine because there's an increased risk and it's a real risk and it's something that's happened. You had about like that is how we're supposed to evaluate things. And you may be right or wrong. Your kid may get really sick with Haemophilus influenza and you kick yourself because you didn't do the vaccine, but that's life. I mean, you're going to also have a risk from the vaccine too if you do it.
Absolutely.
And that's where it's hard for a lot of parents, because they're educated, they understand the risks of the disease, and they still don't want to do the shots for whatever reason. And maybe it's not forever. Maybe it's like right now. Maybe they want them to be a little older. There are a lot of different situations. Everybody's different, but it's not really possible in California, and very few things are even labeled as a reaction to a vaccine, even if it very well might be. Yeah. And so it's very hard to get an exemption, because even if you had a reaction when the kid was 2 months, you're like, well, is it from the vaccine? Did it just happen? And you don't really know most of the time. Like, there's no easy way to prove 100% that
absolutely
vaccine caused your seizure. I mean, it's like, it happened an hour later, probably, but I mean, you could have just had a seizure anyway. So you can always get around that as a doctor, and they often do. And there are situations, I mean, I've even had kids where they've come later from other practices. I had one kid who had a really super fast heart rate after getting a shot, and the first one's at 2 months, and they had to go to the hospital because it was so high, and then it came down, and they were like concerned that it was a reaction from the vaccine because it happened right after, and the doctor's like, well, I don't know, probably not, it probably just, we don't know. So they didn't label it as a reaction. And then, 2 months later, they go back for their vaccines, and they're having a discussion, not really sure if they're going to do it. The doctor convinces them to do it. They agree. They go back. They get the shot. Same thing happens again. So you're like, okay, I mean, maybe it's not from the vaccine, but like, come on, right? Like 2 times the same thing happens. They go to the hospital. Still nobody writes down it's a reaction. Still nobody says anything about that. They still force them to get their vaccines and kick them out of the practice. They're like, we don't want to do this anymore. They had an older kid, fully vaccinated. So they're like, not against vaccines, but this kid's having a reaction clearly, most likely. And it's not anti-vaccine to be like, well, they're having a really bad reaction, so maybe we wait on this. Maybe this is not the kid that we need to vaccinate. And the doctors would kick them out of the practice because they wouldn't do more vaccines. And it's like, that's insane. Like, that is not the way we should be practicing medicine. We need to have some common sense here, where there are certain kids that obviously can't, take Tylenol or any medication. So why should you getting 20, 30, 50 vaccines never cause an issue for some kids? Of course,
exactly. And it's so weird to me how, like, if you're a parent and you give your kid amoxicillin and they come down with what looks like an allergic reaction, and you tell your doctor they have these hives, or they are explaining of coughing or throat itching or whatever, I think they're having a reaction. That doctor goes, okay, and they believe the parent, and they put it in the medical records, and they give the child a different antibiotic down the road, right? They just switch it up, it's no big deal. But that same parent tells their doctor, hey, you gave my 2-month-old 8 vaccines 45 minutes ago, and they're seizing in the car seat. And they're like, well, we don't know it was the vaccine. They're totally fine. I mean, it just happens. Like,
no, I literally made that comparison in the book. Like it's such a weird double standard, and you don't think about it. I never thought about these things a long time ago, but you're like, oh, it's a little rash. It probably doesn't have anything to do with amoxicillin. It's probably to do with a virus. But you're like, okay, never take amoxicillin again in your whole life.
Right.
And then vaccine, you have some super serious reaction. Maybe it's not to do with that. And you're like, nah, it's not the vaccines. It's like, what? Like every other thing, we're like totally okay with waiting or never doing it again if you have a bad reaction. And this is a much worse reaction than just having a rash. And
Absolutely.
that, it's insane. It just doesn't make any sense. And I think, there are many reasons, but for sure for me, I was never taught any of this stuff, right? You don't think about it.
Medical doctors, just to confirm, you are a real licensed medical doctor, and you were not given in-depth instruction on vaccines. Yeah,
I was at a top 5 program, like very good program. Had great training in pediatrics, but you don't think about that stuff when you're in training. What they teach you is, here are the horrible diseases that we used to have. Here's how bad they were. Here's the new statistics. Like, we don't have these things. The vaccines are the best. We've stopped people from getting polio and this and that. And like, vaccines are fantastic. Okay, here's your schedule. Good luck. That's what you're taught. And you don't think anything else of it, because all you ever hear is vaccines are the best thing ever. They're safe and effective. The problem is 1 in a million. Anti-vaxxers are crazy. And that's all that you know. And you're so busy. And you don't think anything else. Like, why?
You're trying to survive residency.
Yeah, and even when you're done, you're unless you get outside of the system where somebody points this information to you, you don't think about it. And I didn't. I'm lucky. I met my now wife during residency. She's very holistic minded. It helped me to get outside of the system a little bit. I went into pediatrics to prevent disease. I always love working with kids, and I was not feeling like I was doing that. I was not really preventing anything. Everything was like quick visits and medications for everything. And once you get outside of the system just a little bit and you do some functional medicine training or read some stuff about integrative medicine, you're like, oh, like, of course this makes sense. Like, at first you're like, oh, it's all woo-woo stuff. That's what you kind of hear. And you're like, no, of course I should be thinking about what we're eating.
Yeah,
like getting exercise and the toxins. Like, so not woo-woo. It's so basic, but you just don't think of it.
Right.
And so you kind of go through. And then for me, because I was in integrative medicine, I started doing that. Then I started getting all these questions about vaccines. Mm-hmm. People were coming to my office because they want to talk about vaccines. I'm getting all these questions online about vaccines. And obviously, over the last decade, I learned more because I'm just getting questions. But still, I didn't know most things. And I still really didn't know anything, honestly, or like really a lot until I wrote the book. Like, until I started working on it, because there's just so much that you're told or you assume based on what you're told. And then you go look at the research and you're like, wait, what? Like, that's what the research is? Doesn't make any sense. Especially with like autism and vaccine stuff. You're like you told
tested one ingredient in one shot and made a declaration.
Right. And you're like, like, I have a master's in epidemiology, so I've done research in the past. I've done a literature review before, and obviously don't know everything, but I know enough to be able to look at the research. And you go look at that, and something like vaccines and autism, where the statements are so definitive, like, we know it's been debunked. And you look at that,
science is settled.
Like, there is no possible way that any doctor who looked at the research for 15 seconds would ever say that. They just don't know. As I didn't know. When I went to write the book, what I thought I was going to write for that chapter was going to be all this evidence that shows that vaccines don't cause autism, and this is why we have these great studies. We've looked at vaccinated versus unvaccinated. We have this great body of evidence that shows that it doesn't cause autism, but there are some other things. It's not as definitive as we're saying. And like, here's some of the other things that I've heard. And here's some of the other studies that have come out. They're not as good as these other studies. These are bigger, better, whatever. But there is some other stuff, so we shouldn't be as definitive. But like, this is why we say it. Then you go look, and there's nothing. Yeah, like nothing at all. Like, it's like crickets. MMR, thimerosal. There's nothing on most of the vaccines, and I didn't believe it. Like, I know. I couldn't believe it. I had to read, I read Paul Offit's book and Peter Hotez's book. I read so many things after I did my own research. So like, I must be missing something.
Yeah.
and it just doesn't exist, and it makes no sense.
Yeah, no, I agree. And I remember, through my own 25-year journey of advocating for this and really researching and diving down and understanding how pharmaceutical drug safety science and trials are so different from a biologic vaccine safety trial, and how those differences and the leniency afforded to the biologicals does not benefit the recipient in any way. And then it creates such a risk that isn't disclosed to the recipient. Like they're not told, oh, hey, this vaccine was tested against another vaccine, who before that was tested against another vaccine, before that was tested against nothing on like 200 people for 4 days,
Right. And you don't know that unless you actually physically look at it.
Absolutely.
If you just follow the no, they're super extensively studied, and we've done all sorts of research. They've done lots of research on it, but they have never done for most of the vaccines we give our kids the best kind of research.
They have not.
And that doesn't mean that they're unsafe. It just means they never did it. And, especially when you're hearing someone like Secretary Kennedy talk about this stuff now, it's like, no, we may have some ethical issues around going back and doing some of these things where it's kind of a catch that's unfortunate because there's this ethics of, well, you have a vaccine on the market, it works, therefore you can't not give it to kids. Okay, I get it. That's complicated. We'll have to figure out how to deal with that. But at least at a minimum, we should be able to say, look, if you're going to create a new vaccine and you're going to ask me to inject a new thing that's never been on the market before for a new disease or whatever, we're going to require the best possible research from the companies. But that's not anti-science. That's like literally science. We're like, no,
literally science. You're asking for literal science. Right.
For the new thing, so we can have the best safety research moving forward. There's no reason why we should require that. Why would you want to give a baby something that doesn't have the best possible research and the best possible safety data? We shouldn't let the pharmaceutical companies submit a proposal for the new vaccine without ever having done that. Like, it just doesn't make any sense. I agree. I'm not against it. Why wouldn't I want that if I'm going to give this thing to my kid? Like, I want to know that
that's one of my biggest beefs is that lack of transparency in data. Because you go and you read the research and it's crap. Like, it's not quality research, and there's no real way to determine based on what they're providing. And they're so strong in their statements, and they're so quick to go to character assassination for people asking reasonable questions like you are. And all that does is set off my BS meter even higher, right? Because if they were so safe, it should be able to be demonstrable. And I remember looking on the CDC website and coming across to document the history of the vaccine information sheets. And they had this table that was fascinating. It was, the original 1986, informed consent requirements for vaccine recipients to be disclosed, right? And it was 10 points that was actually very similar to what our pharmaceutical drug disclosures are, right? And then in 93, they went through and amended it and took away six of the 10 points. They took 60% of the way, and it was just 4 points. And then they went back in 2016 and said, you know what? We can put all of this on a website. And so we're going to put these things from the 93 revision on a website, and we're going to make the new legal requirement for vaccine recipient informed consent disclosure to be a vaccine, a website included in the appointment notes that has all of these 4 points. I remember reading that and going, every time I go to the doctor, and maybe you can correct me on this, I get my appointment notes at the end of the appointment. So if the only legal requirement is a website at the end, how is that informed consent?
Yeah, no, it's not. The thing is, there's no way to do true informed consent. I mean, we don't actually know. So
exactly,
you can only inform people as much as you know. And my conclusion, if there any conclusion for a lot of this stuff, is we just don't know. There's so much that we don't know. Like, I think we have a good understanding of the diseases. Pretty good. Yep. We have a good understanding of the vaccines and how well they work. I think we have a good understanding in general of the risk reduction you might get from vaccines, and even short-term risks for the most part. I think we have a decent strength, understanding of, but I don't think we know anything or very little about long-term risks. And that's the piece of the puzzle that is really important.
It is.
I think because that's where we can make a risk-benefit calculation. I understand, things were different 100 years ago. People were dying of infections. They're not really as much anymore. So it's a different world. And there's a lot of autism and ADHD and asthma and autoimmune conditions. And the question is how, if at all, are vaccines related to these things? And that matters, because if you have a 1 in 100,000 chance of having a serious reaction from measles or something like that, then you want to know, okay, well, what is my risk of dying from the actual vaccine? And what's my risk of getting an autoimmune condition? That makes a difference. It's a big difference if it's 1 in 1,000 risk or 1 in 1,000,000 risk. That actually makes a huge difference, especially for things like, say, hepatitis B for a newborn, which if the risk
in a mother who's a known negative
is a known negative and the risk of the disease is actually super minimal, maybe not zero, but just very, very small.
Yeah.
Okay, but if the risk of the vaccine increases your risk of asthma and autoimmune conditions by 10 times or whatever, then that benefit doesn't outweigh the risk, or at least you should be made aware of that so you can choose if you want to do it or not. Because maybe you have hepatitis B, then maybe that's different. Your kid should probably get the shot. But other than that, maybe not. And if we don't do that kind of research, we won't have better, safer vaccines. And we need some humility. Like, medicine's so arrogant.
Yeah.
And we don't have the best vaccines we're ever going to have in the history of vaccines. We don't know that we have the best schedule we're ever going to have. Like, we want to make things better. And I don't want kids to get infections and die, but I also don't want them to get chronic diseases and be sick. So we want the best vaccines that decrease your risk, but also minimize your side effects and minimize your long-term risks. And if we can't ask questions and study that, then we're never going to know. And if, for example, a vaccine, let's say Hep B, increases your risk of asthma by 10 times, like, don't we want to know that? Don't you want to know so you can say, okay, why? What ingredient? What's happening? Let's change that ingredient. Let's change the schedule. And then maybe we can still get the protective effect without the risk. Like, that's not anti-science. That's like, I want to protect kids. You want to have healthy kids. And I don't care if they get 10,000 vaccines or 0 vaccines. If they're healthier, I want to know what's going to make them the healthiest. That's what we have to figure out. And we don't actually know. We don't know it at all.
Right. No, I love that acknowledgement. And when we look at the schedule, can you remind our audience, when you see that big schedule for 2025, how many actual illnesses, like viral or bacterial, are we vaccinating for? Like, not how many doses, but how many things, right? Like,
it's a lot. I mean, it just depends on how, what you qualify. Flu shots every year, COVID shots, but it's like above 40, 50 pokes. You're getting a lot of pokes, and then you're talking like around 100 now. Individual.
But isn't that for like 16 like infectious diseases total? Like,
Yeah, exactly. So you're going through, like 50,
how many infectious diseases do you think are out roaming in the wild?
A lot. Many.
And what would that vaccine schedule look like, right? Like, if we did nothing about vaccines.
But that's the point. And I made this, just because you can make a vaccine doesn't mean you should. There can be too much of a good thing if you believe it's a good thing. And there has to be an upper limit. And for whatever reason, medicine's like, there's no upper limit. You've seen, like, I'm sure you've seen like Paul Offit and other people like, oh, you can get 10,000 vaccines. It's totally fine. And I'm like, and I hope I get to talk to him one day, because I really want to ask him. Like, I just don't understand. I don't understand the thinking behind it. Like, I get the general logic of like, okay, well, you eat an apple and there's a bunch of bacteria and other things on the apple. You're getting all kinds of antigens all the time. You're ingesting them. So, okay, your body can handle lots of antigens. Okay, maybe that's true, but something you're eating or something natural is not the same thing as something injected. It's synthetic.
Absolutely.
But even if you could get 50,000, 10,000 antigens, let's just say, I don't know that that's true. It's not true, but let's just say you could. It's still not, there's still a lot of other stuff in the vaccines. There's obviously an upper limit to the aluminum you can inject. It's not the same thing injecting something. So it doesn't make sense. Like, there's an upper limit. And if we're doing 6 vaccines on one day, if we're doing multiple antigens, like, there is an upper limit at some point. And people are like, how many vaccines do you want my kid to do today? That's not unreasonable for a parent. Like, that's not anti-vaccine. You're like, I don't know if I want to give my kid 6 vaccines. I don't know if I want to do 70 shots. I don't know. You're going to make me do 10 today? Like, is it just always safe no matter what? Like, that doesn't make sense. There has to be an upper limit. And the question
that's not true of anything.
Right.
Even like, too much water. You drink too much water, your electrolytes get out of balance, you can have a heart attack. I mean...
Right. And I want that safety data. I want to know, like, okay, you do 6 shots, is, I'm not have to worry. But if you get to 8, you do. You get, like, that's what we do with everything else. Like, yes, you could handle a little aluminum from the environment. Yes, you can handle a little, metal, like other things. We can, but at some point it's too much. And we start to get safety studies. And when we do, we can actually figure out, like, here's where our upper limits should potentially be. And this is outside the safety region. And then, okay, we'll make changes. Like, maybe we do 1 on a day. Maybe we prioritize in some of the vaccines we just don't need anymore. Maybe you can say, oh, we don't have polio in 40 years. Like, do we need to give that to a 2-month-old? Maybe give it to them when they're 10. I don't know. Like, that's for people to figure out and to adjust as the world needs it. But you can't just keep adding more, I think.
Right. Without any data to support those additions.
Yeah.
In the middle of an explosion of the sickest generation of kids we've ever had.
So, we don't know what these things do cumulatively. Nobody studies that. There's nothing like them. There's nothing long term. So it's so unfair for parents who start to look into these things. And it's not anti anything. Like, you want to have better information. Like, it's literally the opposite. You want more science.
Exactly. I agree. And also the slur of using anti-vaxxer for people who have been vaccine injured. Like, how anti a product can you be when you took it and were injured by it? Like...
Yeah, that's what happened. I mean,
I know.
COVID happened, and people saw the lies, and they saw the mistrust, and they saw being, kind of gaslit on many different things. maybe they had a reaction themselves. Maybe they had a friend that had a reaction. We saw reactions. Some people were like, well, wait a minute. Like, this is what you're telling me about this vaccine. This is the way that this happened for me or my friend. Like, okay, what about the other vaccines? And then you just even poke a toe in the water and you're like, wait a minute. Like, that's what the research is.
Yep.
And now we have this like huge problem that people don't trust medicine anymore. They don't trust doctors. They don't trust the CDC or the agencies. They basically don't trust anything, and they don't want to get vaccines. They don't want to do anything. And we have the highest rates of exemptions, the highest rates of people not getting vaccines, and trust is gone. And that's a big problem. And medicine's solution to that thus far has been like, just double down, just force people to do it.
Double down and make it worse.
Work. It's just making it worse. Like, they're actually creating the hesitancy they want to stop, and it's exploding.
Right.
And the solution is not to do that. The solution is to have conversations.
Yeah, I mean, you had mentioned earlier, like, the adverse event rates, and I know that VAERS is horribly underreported. I don't know how familiar are you with the 2007 CDC-funded Harvard Pilgrim study?
Yeah, I know. Well, I mean, that kind of shows that it's way underreported, which of course is true because it's self-reported. And I mean, it's worse than that because you actually have no idea, because the question is, well, what is a vaccine reaction? So we don't actually know, like, if asthma or other things for some people are a reaction to a vaccine or it increases risk. None of that's reported. So at least at a minimum, it's a very small percentage, because who's reporting it and who's saying it's a vaccine reaction? I mean, the people could do it, doctor could do it, the company could do it, but nobody really ever does. And other than the COVID vaccine, I mean, everything else, I think the COVID vaccine is probably way overreported, but I think there's still a lot of problems with the COVID vaccine, but I think that's probably overreported because at that time, because everyone was so focused on it. Maybe not, but
I don't know. I think the difference was that the COVID vaccine injured are mostly adults who were more easily able to articulate and identify what shifted for them when things started to go sideways. Whereas a lot of the other VAERS reports filed are for juveniles, maybe kids who...
What I'm saying, I guess, more by that is I think that we were so aware of all the COVID stuff. And so anything that happened around the time anyone got a COVID shot, they would, I think, ascribe that to the COVID vaccine. May or may not be true. Some of it was, most of it's probably true. I don't know. But I think that is like separate to me than the 1%. I don't feel like we're getting 1% of the COVID vaccine injuries versus like, I think we get a lot less of the kid vaccine.
I mean, the Harvard Pilgrim said that the overall risk of adverse vaccine reaction was 1 in 10 reporting a reportable adverse reaction. And this was pre-COVID, obviously. I mean, that's a far cry from what the marketing says.
Yeah, I don't think it's 1 in a million. I don't know what the number is, but it's not 1 in a million. That's right. And that doesn't take into account cumulative risk. And that's, even if it is 1 in a million, which is not, 1 in a million times 1 in a million times 1 in a million, it becomes 1 in 100,000 or 1 in 10,000 really quickly when you do 70 shots. And if it's not a 1 in a million, but it's 1 in 100,000, then you start getting like a 1 in 1,000, 1 in 100,000 risk. That's very different.
Right. No, I agree. One of our team questions that they wanted to know is they had heard that newborns when they're first born, have an immature immune system by design and aren't able to mount a specific type of antibody response, the same type of antibody response that is the mechanism of how hepatitis B works. So is that true? Like, can a newborn on first day of life mount an appropriate immune response with their immune system that's trying to be elicited by the Hep B shot? Is it the same at 2 months and 4 months when they're repeated? Like, I don't think it's the same. Okay.
I mean, there's no question that as you get older, your immune system matures and progresses and gets better at what it's supposed to do. That's why some of the vaccines, you don't even give them till you're older, especially because at the beginning of life, if you're breastfeeding, you're getting mom's antibodies. Yep. And so if you do get antibodies to something, you're probably not going to mount a very good response to that vaccine because the pre-made antibodies are already going to affect, you're never going to mount that as response, maybe. So certainly the younger you are, probably the I guess, less mature the immune system is. So yeah, you probably don't mount as robust a response as for other people. It doesn't mean it doesn't work ever. It doesn't protect you. It does from the research to some degree. I mean, if your mom has hepatitis B, then the vaccine seems to help. So I think there's some pretty decent research for that, but
that's such a small subset of women.
That's the question. But for the rest of the risk, I don't know.
Why is it standard of care?
Most people in my office don't choose to do hepatitis B at birth. Very, very few do. I've never seen it be an issue, and they just do it later if they want to do it. I think that's low hanging fruit to be a change. It doesn't make any sense anymore.
Right.
I understand the theoretical global risk that somebody could get hepatitis B, but the point is you explain that to families. You make sure they don't have hepatitis B, both partners. And you say, look, someone could bleed on you. Somebody could come in your house that has hepatitis B and your baby could get it. That's your choice. And some people might say, no, I don't want any risk. That's fine. But I think 99% of people, probably more, would be like, I think the risk for hepatitis B is super small for my baby. I'd rather get the vaccine later. I don't want the risk from the vaccine, which is obviously there to some degree. And I don't think there's any problem with that. That's an anti-vaccine. It just doesn't make, most countries don't do hepatitis B at birth.
No, they don't. We're one of the very few.
So it's not like again, it's arrogance. It's like, well, just because we do it doesn't mean it's right.
Right. No, I could not agree more about that. So another question that was from our team was they wanted you to be able to go in depth about sterilizing versus non-sterilizing immunity produced by vaccines. Because some vaccines are designed, to stop infection transmission, and some are designed to just reduce symptomatology. Tell us more about that. And then what is the public health benefit of a non-sterilizing vaccine?
Yeah, so I think that's the basics. You kind of mentioned it. So sterilizing, you're basically stopping somebody from getting the disease. So you're not able to get it. You're not able to pass it on, which most vaccines don't actually do. Most just protect you. They protect
Which ones provide sterilizing immunity?
So the ones that we think more of, like the measles, is like really, the ones that have a longer incubation period. So that way you have more of a chance to actually mount a full response before you ever get sick. Polio is another one that sometimes people mention. And there's a lot of questions and controversies around that, but I think of anything like the smallpox vaccine was one, theoretically, and then measles, because they have such a long incubation period that if you get exposed to it, your body can mount a full response. You never have any symptoms. You don't pass it on to anybody, and we can theoretically get rid of that disease. That's the theory behind it. Most vaccines don't totally do that. They might prevent you from getting sick. Maybe they prevent spread. Maybe they don't. And I think that's a big, one of those things where just people don't really understand that. Certainly I didn't, again, back in the day. And I don't think most doctors really do, because you think community immunity. We want to prevent, Johnny from getting sick who has an immune deficiency. And of course we do. We don't want anybody to get sick or we want to protect babies. But you have to also be real with what a vaccine can do. And many of the vaccines don't protect other people.
Right. They only protect you.
Some do. Some do. And that's fine. And there's nothing wrong with that. But that's just what they do. So there really isn't a lot of reason for, especially the vaccines that don't protect other people, to force those on kids to go to school. That doesn't make any sense.
I agree.
Still do. So again, it's they're just logical, common sense things where you're like, okay, let's say for measles, you're like, we don't want a measles outbreak. It's going to protect other kids. We don't want it here, so we're going to force it. I don't believe in forcing, but that at least makes sense. When you're like, oh, let's stop people from making sure everyone gets tetanus shot. It doesn't protect anybody. It's just protecting you maybe, or even whooping cough. There's some research shows that maybe have more chance to spread, or at least it doesn't protect other people totally. So it just doesn't make a lot of sense to force those things. And even for the whooping cough, I talked about this because this is really interesting stuff, like cocooning around a newborn baby. It actually doesn't make a lot of sense. It actually makes negative sense to me now that I've really looked into the research, where there's a good amount of research that shows it started with the baboon research, where they injected the baboons, and then they showed that they could still be colonized. They could still pass it to other baboons just the same, maybe more so. And they've repeated that in humans, and it still shows you could be colonized. You can still pass on whooping cough, even though you haven't had a vaccine. And then you have to think, okay, well, does that make a lot of sense to cocoon a baby then? Because you might be preventing symptoms, but then you won't know that you have symptoms, and then grandma gets the vaccine and she, doesn't have any symptoms and carries the baby and kisses the baby when they have whooping cough in their nose and they make them sick, versus you have a cold and you're like, okay, I probably shouldn't be around. So it's debatable because, maybe it decreases symptoms, maybe, I don't know. But I think it just doesn't make a lot of sense to...
that piece you just admitted, which was fabulous, by the way, thank you for that clarity, right? That you can get the vaccine and become an asymptomatic carrier. And you, the recent vaccine recipient who got the vaccines to protect the baby, could actually be the source of that infection for the baby. And
that seems more likely to me if you're an asymptomatic carrier. I wouldn't go around a baby.
Why aren't more doctors honest about that? Because I meet grandparents all the time whose kids tell them they can't come and meet the grandchildren until they've...
I don't think people know. You have to know that research. I think if you know that research, there's a very good argument to be made that this doesn't make any sense anymore. So
the marketing. Do you remember that commercial that had the the wolf dressed as grandma breathing on the baby. Like, that is come now.
It's crazy because, like, there's some things that are like maybe more out there for people, but like there's like very good
evidence,
team research on this from like very pro-vaccine doctors. You go look at it, and they're like, the research does not show that this is actually effective. Like, you can look and it's like it's the conclusion. Like, maybe we need to rethink cocooning. It doesn't seem like it really is effective. Like, we have good research review, like lots of stuff on it now from people that are so it's like, this is old. It actually doesn't make sense, and you're just making people get a vaccine, and you're potentially increasing the risk. You're at least not decreasing it. I don't think.
Absolutely. So you're not benefiting anyone. The rate of harm can be debatable, but there's definitely not a real clear benefit. And they're just not told at all. And they're told the opposite, that it's a path to protection. And it's so frustrating, because like those risks of, of whooping cough in a tiny baby are real.
They're real. And it's a real risk. And that also gets to, and then you're not discussing the real things that you can do to protect the baby. And the real discussion should be around breastfeeding, because that's what you can actually do.
Absolutely.
And then if you do want to get a vaccine during pregnancy, and I'm not recommending it, I'm just saying, like, if you did that, for sure, like, you get the vaccine, you have antibodies, you can pass it on to the baby. So that seems to have some positive benefit in terms of prevention, if that's what you choose to do. But giving everybody else a vaccine doesn't seem to make any difference. So there's not really a lot of logic to do that, or at least to force it. It's just, if you want to do it, go for it again.
I mean, here in Texas, we actually audited DSH's, our state health department, and got our pertussis data. And it clearly showed that the vast, vast majority of documented, confirmed pertussis cases in Texas were all vaccinated people. Like, it was a landslide. Wasn't even a question. And again, backing up that statement you said about we need to maybe rethink a few things on it. I mean, it was just astounding to me. And you said earlier, a second ago, about the RSV protection being passed on to the baby. So tell me more about that. I mean, because isn't the RSV new one an mRNA-based shot that's given in pregnancy? Did they study that in pregnant women? Like, how do they know that that's happening?
Yeah, I mean, before we go on, so I guess again, with the DTaP vaccine and Tdap, I mean, this is, again, a discussion we're having. Like, the vaccine doesn't work very well.
Right.
There's no question about it. Like, that's not anti-science. Like, you have to get 5 as a kid. Then at once every 10 years, you have like a 10% decline in activity every year. You have basically no activity after 5 years or so. It's like, that's a bad vaccine. We're giving something to a kid 5+ times. Like, no, we need to go back to the drawing board and make a new one if you're going to do it. Like, we had one before. The old one worked, just caused a lot of issues, but it worked. Right. So maybe there's some other one in between, or a different version. But why are we giving kids 5 of the same shot to then like give them more in the future? That makes like no sense at all. Like, maybe we create an antibody shot for the first couple months, like RSV. Maybe there's something else that we can do so that it actually protects them without the side effect. I don't know. It just seems really weird to me that we'd be like, give kids 5 of the same vaccine in the first year.
It's tied with tetanus, which is a much more durable vaccine that lasts much, much longer than the pertussis component. So it's like, it feels like you're either under-vaccinating for pertussis or you're over-vaccinating for tetanus.
And diphtheria. Like,
yes, and also diphtheria.
There's probably no need for a diphtheria vaccine. At least at a minimum, you could certainly do it later, and you can probably just give 1 or 2. I don't know. Like, there isn't a lot of diphtheria, so it's kind of not that useful part of that vaccine. But it's in there. But you're giving kids like 5 of them, which doesn't make any sense. And then tetanus, like, baby doesn't have really any risk of tetanus, so they don't really probably need that. But even if you do, you could just do it later, and you certainly don't need like 5 or 10 of them. But the whooping cough is really the part that you're protecting for, and that makes sense. I mean, babies die from whooping cough, so I get that. But like, maybe there's another way, a vaccine that we don't need 5. Let's create a new one. I don't know. Maybe you can make a live. I don't know. I'm not like that kind of scientist, so I don't know what the deal is. But like, if you could just talk about that, like, hey, like, what do we want to change first? Let's get a better pertussis vaccine. Like, why is that? You can't talk about it. Like, why
is that so controversial?
Why do you going to give diphtheria when they're not getting diphtheria? Like, it's not. You can't just give vaccines forever. Like, let's bring back smallpox vaccine. No one's had smallpox in 100 years, but like, why not? We have it, so let's just give everyone one. Like, that's not the right attitude.
No, and the pressure for tetanus compliance. Like, we get reports, panic calls from parents and ERs all the time because their kid, scraped their knee on the playground and the doctor wants to give them a tetanus shot, and it's like a scrape.
That's also crazy.
It's not a puncture wound. There's no anaerobic activity there.
Yeah, and even if they did, the vaccine probably wouldn't help them anyways.
Absolutely.
So like, it's another like weird, I don't know, marketing, like rusty nails had a bad marketer at some point. Like it's nothing to do with rust.
I know.
It has to do with like farms for the most part, and like rusty nails because they're on farms, but it's rust because you're outside of the farm. That's where it came
and
from.
It's because it's got to be that deep puncture wound that doesn't bleed, because it has to be an anaerobic environment. Like if it gushes blood, odds are low.
And it's fine. And even if you did think you had tetanus, then you probably shouldn't do the vaccine. I mean, you could if it's really early and you get lucky, but mostly it wouldn't help you anyways.
Right.
So just to give a vaccine every time you get a cut doesn't make any sense. There's no science to back that up, because why? Like they're like just a couple of cases of tetanus every year. It's like 30.
Yeah.
It's not a lot. So it's not a big risk. And there's no reason with that small level of risk that you should be giving everyone with a cut tetanus shot. If you're like on a farm.
What is the appropriate treatment to ask for if you get actual tetanus exposure?
If you have tetanus exposure, you should get the antibodies. You should get the antibody injection, and that will work right away because it's antibodies. Like that's.
And is that readily available at most emergency rooms across the United States?
It's available to get it. Not every emergency room has it. Every hospital would have access to it. So you might. I mean, if they didn't have it there, they would get it to you. Like you usually don't need it this second, so they might get it to you that day. Big hospitals would have it.
So definitely possible.
It's possible. I mean, people get tetanus every year, but the vast majority of them are on a farm and they get a really bad puncture wound. They don't clean it properly and they close it off, and it just grows. And even with mostly like a tetanus, it's not that bad. Like, yes, it can be really bad, but most times it's not. So you're talking about like maybe 5-10 cases a year of bad tetanus for giving everybody a shot. And again, it's like that's risk benefits. You could say like, well, okay, this might prevent you 1 in a million times. If you choose to do that, fine. That's fine. Like it's available, but the question is at what risk? And I think I think that risks outweigh the benefits most of those times, especially if you just have like some cut, you fell on the ground and you're like, oh, it's a bad cut. We should give it a tetanus shot. No, like there's no benefit there. So there is no benefit. It's just only risk.
And it just makes your body have to fight off whatever toxicity is inherent in that shot.
And now you're giving it a shot while you're trying to heal. Right. It's like, oh, should we give you a shot while you're sick? No, it doesn't make any sense. Like you're trying to heal. You want to give a shot, do it when you're better.
Well, and some countries have access to like individual shots, like they can do a tetanus, a diphtheria, and a pertussis separately. But we lost that ability decades ago. What do you think drove those decisions of why everything keeps moving in deeper and deeper combinations?
The easy answer is money. I mean, it's just easier to create shots that are together, so people don't have to do as many. They get more at the same time, and it just costs more to have multiple things around. The logistics are harder, so let's just keep individual ones, which I get. I mean, I don't think that's totally wrong, but they don't make sense anymore. Like they were created at a time when maybe you did want all three, so that makes sense. But I don't know that we necessarily need them, or certainly don't need them at the same level that we used to. Just like MMR, I think that's the same thing. There is a lot of benefit to having just a measles vaccine. We used to have one. It doesn't make any sense that they don't bring that back. Like that of all the vaccines for doctors is like the big one. Like they want you to get it. They're all scared of measles. So they should have a measles vaccine. Like it should be available for people if they want to get just that one. So they don't have to get the other things. If that's what's going to make you more confident to do it, fine. Like there's no reason we shouldn't have that. You don't really need the rubella vaccine unless you're, to decrease your risk for pregnancy, but it's not a huge risk. Mumps, there is a risk, but not a huge one. But measles is obviously the bigger thing of that vaccine. So like we should have that available. We should have whooping cough available on its own. I think those would be reasonable to have.
Yeah, I agree. And with the mumps, like the mumps component of the MMR is not known for its efficacy. Like there are countless stories, it seems like, of 100% fully vaccinated populations coming down with the mumps.
Yeah, mumps
after vaccination.
Like whooping cough is not perfect. It's not as bad as whooping cough in terms of efficacy, but because the efficacy on whooping cough kind of goes down. Mumps does too, but it's just like it's like 70-90%. So there's it's still good, but it's not great. Right. And so you certainly can get mumps still, and you can get it as you get older because immunity wanes.
Right.
So that's a part of vaccines and just a part of the story that we don't acknowledge. Think just like measles. It's like, well, okay, we don't want anyone to die of measles, but we have a different world now because now everyone had the vaccine, or many people did, and then immunity wanes as you get older, and so it still can get passed around even if everyone's vaccinated, because a lot of people, their immunity is gone from it, as opposed to actual disease where you have immunity for life probably. So we certainly get better immunity from diseases. It's just obviously you don't want to die from the disease. That's the point of the vaccine, I guess, but you do have a trade-off there that you have to at least factor in.
Yeah, it sounds like you're describing the difference between natural acquired immunity, which is durable, more longer lasting, and then vaccine acquired immunity, which is temporary and partial.
Yeah,
Right?
which was a crazy part of COVID, right? Where, oh, immunity doesn't count. You're like, what? What?
I
That was
know.
one of the two big
I
things for
thought
me.
that was one of the most.
Made no sense.
There was so much crazy during the pandemic. It was hard to pick one of the big things, but that was one of those things that I was like, what? Natural immunity doesn't exist? What are you talking about?
Yeah, that was one of the big ones that kind of pushed me over the edge to like really being like, what is going on here? Because anyone who's been through med school or has been, you're like, of course it counts. Like, what are you talking
Right.
about? That doesn't make any sense. Like, you for sure have better immunity than from a vaccine. You get one part from a vaccine that's not natural versus the actual disease. Now, yes, you have to not die from the disease. So the vaccine can protect you from that
Right.
if you're a good vaccine. That's the point of it. But to say that you've had the disease and then you need to get a vaccine or it doesn't count, that's never been true of anything else in the past for anything. So why would that be different for this? That's purely propaganda and purely for the fact that they just don't want the logistics of having to deal with the fact that people have had it. So therefore they don't need to get their vaccine and want people to get vaccines. Like, that is fully marketing. And,
Right.
and that was just so wrong. So wrong.
I agree. I mean, there was just so much madness that was happening during that time, and people just couldn't get clear information one way or the other. And like, I've never seen that kind of propaganda machine and obvious overt coercion.
Yeah, and it's still going because
Yeah, it is.
you look at like COVID, and this is what's really tough, I think, for a lot of parents, or you have two worlds of information, and you have COVID vaccine was really great and saved millions of lives and saved trillions of dollars, and it prevents, decreases your risk of illness, not so much death, but of severe illness, and you should still get it. You should still get it if you're a kid, still get it if you're pregnant. It's really beneficial and it decreases your risk. And then you have the other world of evidence and information that's like, it's the worst thing ever, and you should never take it, and it kills more people than it helps. And you're like, regular parents like, what am I supposed to do? These worlds are so at odds, and they never talk to each other, and we never have debates, and we never have discussions. And you're like, okay, they both sound reasonable. They both have evidence and reasonable data. So which one's right? And there's no debate and no discussion. You never hear people talking from the other side. And we have to have that. Like, I just think people don't know what to do anymore with vaccines.
I agree. I created an entire communications program to teach people how to have this discussion in a loving and connected way. Like, I'm with you 100%. Like, we have to talk about it, and we have to remember that we care about the person who's in front of us, and that we want to respect their space and their autonomy and their right to have their own feelings, opinions, choices, whatever. I'm with you. It is a challenging thing to do that we need to find a way to do with as much love as we can possibly muster.
Yeah, we need the scientists to do it. Like, we need like RFK to sit down with Paul Offit or whoever. Like, those kinds of people have to sit down in a room
Peter
on TV.
Hotez, right?
Peter Hotez, whatever. Like, they have to sit down and start discussing this and being like, well, we think you're a crazy quack anti-vaxxer, RFK. Here's why. Okay, then they have to put out their points, and he has to be able to like.
But what's amazing
show
is
his research.
RFK's been trying to get that.
I know, yes.
Forever, and like Offit and Hotez won't show up. I mean, there was even like a Joe Rogan sponsored $2 million debate that if Hotez would have shown up and debated RFK, he could have got $2 million for charity, and he wouldn't even do it. Like, they won't show up. Like,
I know, and
they
it
won't
doesn't
have the discussion.
It doesn't have to be with Secretary Kenny. It can be with other people, but like,
yeah,
it needs to happen. Like,
it
people that
does.
have different opinions need to sit down and talk about this stuff, because like, I don't think we know, like, that, like, just because you're super anti-vax and you hate the COVID vaccine doesn't mean it doesn't work. Like, it might decrease your risk of some things. That might be true.
And more than that,
but what the question is, at what cost? And is that true?
Either way, even if that person across from you makes a different choice, they're allowed to make a different choice.
Right.
Just because I make my choice and feel good about my choice and feel totally content with my choice doesn't mean that my choice has to be your choice.
Right. It doesn't mean you're right. That's your choice to make. You can. Yep. We need to bring
allow.
And that's why I tried to write the book. I mean, I don't know all the information, but I know what I know, and I wrote down what I wrote down. But I tried to bring both perspectives, because for people to make decisions going forward, they have to hear both sides, both perspectives, all perspectives. Have debates, have discussions, let the best information rise to the top, and then you make a decision based on that. We're not going to know everything. We don't know everything, but we we can't make decisions based on like vaccines are the best thing ever and they're just safe and you should just always do it, or the worst thing ever and you should never get it. Like the answer's somewhere in the middle, and we have to get both sides and all the information so we can actually make rational decisions, and each person can make decisions that are right for them, because everyone has different opinions. And we started by talking about it, but like religious beliefs and personal beliefs, you might not want to have pork, and there's pork products in some of these vaccines. You might be totally against abortions, and you don't want to inject fetal tissue into your and even though your church says it's okay, like you might not feel it's okay, and that should be okay. Like everyone is different, and you should be able to make decisions that go with your values. And if your values are, I don't want to do this, then okay, well, here are your risks to not doing it. As long as you know what those risks are, Jehovah's Witness don't get blood, like they're allowed to do that. We maybe save your life, but that they choose not to. That's okay. Like that's their choice.
Yeah, that's the choice is the owner of the body.
Yeah.
And, on top of all of that, I mean, that is why we do what we do at TFVC. We are here to make sure that there isn't a government coercion forcing you to engage in vaccination at a level that you're not comfortable with to participate in society in a meaningful way. Like California has unfortunately lost that, and it's tragic for so many people that can't get exemptions and maybe are too unable to homeschool, that feel forced to get these vaccines. Like it's so important to maintain the sacredness of the trust relationship between a parent and their healthcare provider, and to have the autonomy to make those decisions without the government making them on their behalf, right? Because you own the risk as the recipient.
Yeah, and I feel stronger than that than ever.
Yeah.
Now, I'm not particularly religious, but I get, after doing the research, why people, even if their church or whatever says it's fine, you would not feel that way. I mean, I put lots of stories in there and lots of like some of the stuff, the way the vaccines were created, the stuff that they did, with the abortions, how they did things, who they experimented on.
Yeah. The Stanley Plotkin videos were like
dark. I put that
horrible.
whole thing in there. I put all that stuff in there. Like I'm not shying away from it in the book. If you go look at like the testimony that people talk about and what they actually did, I mean, I get it. It's like 50 years later and it's not happening right now. But for some people, that's not within their beliefs, and I totally respect that based on what I've read and all the crazy things that they used to do for research. I mean, it's for science. They did good things with science too, but I mean, at some pretty not so respectable ways of like, injecting hepatitis B in people from like they did all sorts of crazy things. And, like you're like, okay, like we created these products, but like at
what cost?
They wouldn't be able to be done now. Right. So it's like I understand if somebody is like, this is against my beliefs, I don't want to do it, and they should be able to do that. And I feel more strongly after seeing a lot of what was done back then. It makes sense. It doesn't invalidate the vaccine. It just there's a lot behind it.
There's risk on both sides. And it's important for an individual to be able to decide where they place their risk free of coercion and interference by the government.
Yeah. You should be able to choose what you want to do.
You should be able to choose. Right.
And it's not, that is how we do every other thing in medicine.
It is.
There is our job, our name, like doctor, docere means to teach. It's not to tell. It's not to force. The CDC schedule is CDC recommended schedule. It's not the CDC forced schedule. Like I don't know where that changed, but it's a recommendation. And that's fine. You recommend it. If you're the doctor, like this is what I think is best for your patient. I totally believe in vaccines are the best thing ever. Whatever, that's fine. You can believe that if that's what you believe. But that still doesn't mean you should force someone in your practice to do it. Your beliefs don't matter.
Right.
Like they really don't matter. Your patient's politics shouldn't matter. You shouldn't treat someone different because they're like a Republican or a Democrat or they're Christian or a Jew or what. It doesn't make any difference. Your literal job is to like not care about any of that stuff. Treat everybody the same and let them make the decisions and provide information. And somewhere along the way, that's not happening anymore. And this is why people hate medicine and doctors are not liked anymore. And it's for good reason. I mean, we're doing this to ourselves. We're not partnering with patients, and we used to. Like doctors used to be loved. And that's not true anymore. And if it doesn't change, then doctors are going to become obsolete. We're going to have robots replace us or something. Yeah. I don't know.
It's going to be AI and Amazon pharmacy.
Yeah, it's very. I mean, it's very bad right now. It is.
Yeah,
very
I know
bad.
it is.
And it's like hitting a peak now. You have like the AAP suing Secretary Kennedy and like over nothing. It like doesn't make any sense. Like I understand you don't like what he's doing. Fine, you don't have to like what he's doing, but you can't like they're suing because they don't like his decisions. Like it doesn't make any sense. You're like, what are you suing for? there's not like, you're allowed to make decisions. He's allowed to decide things. You don't
He's
have
the
to agree with
Secretary
it.
of Health and Human Services. He has a huge amount of power.
There's a lawsuit from someone who's pregnant because they might not be able to get the COVID vaccine, even though it's still available for you, and they haven't even done it. It's like these are like political lawsuits. It doesn't make any sense. Like, you're not like, where is the head of the American Academy of Pediatrics has been like, look, I don't agree with these decisions. Let's sit down. Let's have a discussion and a debate. I don't agree. It's like, don't jump to lawsuits. Like, that is the last thing that people need. We need discussions. You don't agree with his COVID policies? Fine.
Or like how there was a FOIA request for the vaccine safety data link and they deleted all the data and refused to provide it.
I don't know what's wrong with that. I talked to Dell about it. I mean, I don't know. They're still working on it. Like, what is that? Is that like, if that's true, that's insane. Like, that is absolutely insane. If they did anything like that, like that is.
Because they trash VAERS and say that the data is not good because it's past the surveillance, right? They say, we can't use VAERS because of this. And then, the vaccine safety data link is what they always say is the best impeccable data that isn't available to the public, and they won't release it to us.
I don't know what's going on with that. At least it's not public. But if that is true, it's mind-blowing. I mean, it's like, basically it's an admission. If that's true, like if they blew that.
Think of the lawsuits that had to take place to get the Pfizer vaccine trial data released. It was supposed to be transparent. Our FDA reviewed it in 108 days.
Like, I don't like to speculate because I don't know any of the details. Right. I don't know what happened. But if the people in the CDC before they left disbanded this research data, then the stuff in there is so damning that it's almost mind blowing. Like, that, there's no way that they would do that unless they already have run the research. They know how bad it is, and so I don't know. I don't know if that happened. I don't know what's going on. That's just like that what I've heard. And even Dell, when I talked to him a while ago at an event, he was like, "Well, at first that's what I thought, and then now we're not so sure. So we're like working on it." So I don't know what the actual truth of that is, but I guess we'll find out soon enough. But
I do know that with the Pfizer trials, when that data got released, I began to understand why they wanted 75 years to release it.
Yeah,
because it was very damning.
Well, why would they? I mean, obviously. Yeah. This is the problem with the research in the first place. Is like, well, why would a company ever lie? Like, of course they're good. If they have a product, they're like, and
it's liability free for them.
Well, they're obviously going to show things in the best possible way. They're going to get the best possible people to run their trials to fudge the data, and when you do any research, if you've done any statistics, you're like, you can move the data around and make changes to find anything that you want. You can change what's in there. So if you don't want to be honest, you don't have to be honest. And it's really easy to get a result that you want or to change a result you don't want after the fact. Like, that's not hard to do. It's super easy. So unless you do things honestly, you can find whatever you want. So obviously they're doing that. Like, they're obviously going to show the best possible effects with the least possible side effects. Of course,
like any other business is going to do for their product in their marketing campaign.
It's not their job to be honest. I mean, to be nice, but it's our job to keep them honest. And we don't do that anymore. Like, there's nothing to stop companies from doing whatever they want. They know it. They've bought everyone. They bought everything, the government, the news, medical schools, the journals. They fund everything. Yeah. So nobody's keeping them in check, and they know that. So they can do whatever they want. And it doesn't mean the people are evil. It's just their company. Their job is to make money. Their job is not to make you healthy. And if they make you healthy, it's a nice byproduct, I guess, for them. But they don't They don't really care. They just want a good product that makes a lot of money. Like, that's their job. They're if they don't make more money, they get fired. So that's what they're doing.
Let's hope the FDA begins to do their job. Instead of acting like a trade group, they begin to act like a regulatory watchdog organization as they're supposed to be.
We're moving in a better direction.
It's a better direction than it's been. But I pray for RFK and his ability to tackle the depth of the regulatory capture that exists over there, because it's crazy.
Yeah, it's hard. It's a big project.
It's a big project. So I'm grateful to be moving in the right direction. I'm very grateful for doctors like you who are willing to be humble and admit their shortcomings and try and have honest, non-biased discussions with people and honor their autonomy. Like, I wish there were 100,000 more of you. I think it's great that you're out there trying to bring the ethical credibility back to medicine. I agree that it's been lost. Can you let our audience know where to find more about you?
Sure, yeah. Easiest places are Instagram or X at Dr. Joel Gator, or the book is Between a Shot and a Hard Place. And you can find it, everywhere books are sold, Amazon and all the places, or theshotbook.com.
Awesome. Is there anything else you want to leave our audience with before we end for the day?
I would just say, the people that are listening to you, probably a self-selecting group, but I think for the people that are listening to you, like, it's not woo-woo to have questions. Good parents have questions. There's so many people and so many more people that are having questions, and that's okay. The community is growing, and you shouldn't feel like you're the weird one, or like, you're bringing your kid the extra snack at the party, or you're asking questions about the vaccines or whatever. Like, that's what a good parent does. And we do have to do that because kids are so sick. Mm-hmm. And the only way that you're going to have healthy kids is by doing things differently, I think. Like, that's just the way that we are with 50% of kids with the chronic disease. So It's okay to ask questions, and don't feel bad about that. I think that's fine. And if we keep asking questions, we will move in a better direction, I think.
I agree. Like, respectful discourse is the path forward.
Yeah, definitely.
And lack of government interference. We need to stop those laws are just crushing people everywhere.
Yeah.
Well, on that note, I would like to thank you for joining us to another episode of Shot Callers. I am Carrie Bigford, Outreach Director. We had our wonderful guest, Dr. Joel Warsh, and I hope that you learned something great this episode and consider getting his book, Between a Shot and a Hard Place, and learning more about your rights and the paths that you have to choose. Thank you so much.
Thank you for listening to the Shot Callers podcast. Please, if you found value in this content, rate us and share the podcast with a friend. It's a great way to get the message out and to empower everyone to make informed decisions. Until next time, never forget, we are the Shot Callers.